It is natural that when you travel out of your town, out of your comfort zone for a hair transplant in India or a hair transplant anywhere else in the world, or you get a hair transplant locally at your town, for some patients, anxiety levels are pretty high, and this is very natural. It is a natural phenomenon. The body is preparing you for an event that it is not used to. And high epinephrine levels are an expected bodily response. But when you travel to Darling Bud's clinic, be confident of the fact that you will be welcomed very warmly. There will be no chaos in the clinic. Since we do only one case in a day, the entire day, our undivided attention will be towards your procedure so that you have a comfortable procedure, a procedure that is skillfully done to ensure that you feel at home. And our counselors will be there to guide you at each and every step. And I will be there throughout the day with you, doing all the surgical steps myself. And I do not leave the clinic for lunch. I will leave the clinic only after you have been sent home. So with that reassurance, let me just delve into various points, checklist that you should ensure the day before the procedure.
Is this what you want now?
Just as a well-tuned instrument produces melodious harmony, meticulous preparation for your hair transplant procedure harmonizes your actions, your intentions, thereby ensuring a symphony of preparedness rather than total discordant chaos. So one by one, I will go through the points which you should ensure just before the procedure. Make sure that whatever medications that you are taking, the doctor is in the know of these medications. Certain medications need to be stopped before the procedure. An example is minoxidil. Topical minoxidil, when applied to the scalp, it increases the blood supply. It should be stopped 1 week before. And so is the case with certain medications for psoriasis, for dandruff, and for many other ailments of the skin. If you have had a cardiac event in the past, you should inform your doctor. And if you're on blood thinners, these blood thinners need to be stopped 7 days before the procedure. Like any surgical procedure, the bleeding time, the clotting time, and especially in those on blood thinners, the INR test needs to be done 7 days before in consultation with the cardiologist. Drugs should be stopped only in consultation with your treating physician, your family physician. The evening before the procedure, think of retiring to bed a little early, say around 10 p.m. or so. Do not consume too much of alcohol. Up to 1 pint of beer or 60 ml of whiskey should be sufficient. It is very pertinent to say here that binge drinking the night before the procedure is not advisable at all, and so is consuming drugs, consuming opioids the night before the procedure and also on the morning of the surgery. You can eat most anything the night before the procedure. There are some people who subsist on herbal diets. They take a lot of herbal diet. For them, a piece of advice to cut down on the herbal diet 1 week before the procedure, because excessive herbs cause blood thinning, which can cause bleeding during the procedure. Wash your hair with mild shampoo the night before the procedure. Do not scratch your scalp the day before the procedure. If there is any pimple, any focus of infection, let the doctor know. If you have any cough, any fever, if you're taking any medication, especially aspirin, let the clinic know. Avoid head massages, scalp lotions, scalp medicaments before the procedure. If you are on diabetic, needless to say, you have already received instructions from the clinic during your workup, and please follow those instructions. Bring your entire case notes about treatment from your family physician. Choose comfortable clothing in which you will come to the clinic on the day of the procedure. The best is to have a button-down shirt, a button-down cardigan, or a zippered jacket so that you can put it back on without damaging your planted area after the procedure. The day before the procedure, do not engage in very heavy exercises like powerlifting. Light exercises, cardio is permissible. Swimming is also permissible, but do not stay out in the sun, out in the direct, strong sun 1 week before the procedure, because it could have caused sunburns, and with sunburns, the procedure becomes very difficult. If you want to discuss your procedure or any apprehensions, any queries that you may have, last minute questions you might want to ask or want to get comfortable with the clinic, we can arrange a call with you the day before the procedure or sometime before, as is common with most patients. Avoid dyeing or coloring your hair 7 days before the procedure, because dyeing can cause skin reaction and this can increase the blood supply. It can interfere with the procedure of hair transplant. Refrain from energy drinks, refrain from aerated drinks the night before the procedure and especially on the morning of the procedure, because the position of hair transplant, the first position of hair transplant, is going to be supine position position face down on your belly, and people who have aerated drinks in the morning may feel very uncomfortable. And so will people who have a very heavy breakfast. So if your procedure is at 7 o'clock in the morning, ensure that when you get up in the morning around 6 o'clock, you have a glass of milk or a glass of juice. Do not take coffee, because coffee can increase your heart rate. It can increase your anxiety levels as well. Do not take solid food, because due to bloating, when you're lying face down, you will be very uncomfortable and you will keep moving and disturb me while I'm harvesting. Yes, immediately after the harvesting is over, I will give you a break for about 20 minutes. If the procedure started at 7, and if it is a moderate case, say around 2,500, 3,000 grafts, we will finish the harvesting in about 2 hours time, and then we'll give you a break of 30 minutes, after which the slip making will start. So you'll have enough food breaks during the procedure. Do not overfeed yourself on the morning of the procedure. As far as smoking is concerned, smoking is very bad for the entire body, and so is it bad for the scalp. Smoking is bad for wound healing. So stop smoking 3 days before the procedure and remain off cigarettes for about 3 days after the procedure. Do not get a haircut before the procedure. Do not scratch your head before the procedure. Do not massage your head before the procedure. Do not apply hair gel or oil the day before the procedure. When you come to the clinic, please bring your consultation sheets, your previous treatment record for hair transplant or for any other ailment that you might have for which you're taking medication, for which you're taking treatment from any other doctor, so that we can have a holistic view of your health condition and the procedure can go ahead as planned. There have been many times when the patient has not revealed his health status and we have had to cancel his procedure. It is not only heartbreaking for the patient who's traveled a long distance, but for us as well. We feel bad that you have to go back without a hair transplant. As far as driving to the clinic is concerned, you cannot drive back after the hair transplant. So either have somebody drive you to the clinic or engage a taxi or call the clinic and we'll send a driver to you if you're not located too far away. You can of course drive back 36 hours after the procedure. When you check into your hotel, ensure that you ask room service for 5 or 6 big pillows so that you can be propped up in bed once the surgery is over the next day. If you have a neck pillow, make sure it is not very smooth, otherwise sometimes it slips up and it can damage the planted grafts in the crown area. Similarly, the neck pillow that you got should be of your size. It should not be smaller or it should not be larger in size. It can cause untold damage because sometimes you may fall asleep at night, it can slip up and damage the crown area. So a better thing to use is a large towel taken from your hotel room, rolling it up several times so that it comfortably conforms to the curvature of your neck, and the arms of the towel can cross in front of your chest so that it restrains your cheeks from falling to one side and injuring your temple points and the grafts coming out. So in short, a rolled up Turkish towel is much more safe on the first night than a neck pillow, because a neck pillow, because of its smooth nature, because of its non-conforming nature, can do untold harm to your grafts. So those were the brief points to prepare you better for your hair transplant. If you have any other question, do call us at the number given and we'll be there to respond. We are always there to help you, just a call away. Do not get flustered. So remain calm before traveling for a hair transplant to India, to Darling Buds Clinic. We are waiting to welcome you. Thank you for watching. And if you have any questions, any doubts in your mind about hair transplant, about hair loss treatment for men and women, about traveling to India for a hair transplant, do let us know. Leave a comment in the comment section below. For a personalized consultation, video consultation with me, please leave your pictures and your message on the WhatsApp number provided. Have a nice day. God bless you.